What are the salient findings and diagnosis? Discussion follows in 10 seconds. Most common risk factor for aortic dissection in the International Registry of Acute Aortic Dissection was hypertension. Hypertension was noted in 76.6% in the IRAD, while Marfan syndrome was noted only in 4.4% and diabetes mellitus in 7.8%. 20-year data from IRAD has been published. It is a study involving over 7,300 cases from over 51 sites in 12 countries. Two-thirds were type A dissection and one-third type B. Two-thirds were men and the mean age was 63 years. In general, type A cases underwent surgery and type B cases underwent endovascular repair. There has been a decrease in overall hospital mortality in type A cases, but not in type B acute aortic dissection. Young patients below the age of 40 years are less likely to have hypertension, 34%. They are more likely to have Marfan syndrome, 50%, or bicuspid aortic valve, 9%. In those above 40 years, Marfan syndrome was only 2% and bicuspid aortic valve was 1%, while hypertension was seen in 72%.